otherwise known as consumer-driven insurance and consumer-driven healthcare. We have been talking about Medicare for all. Medicare for all. It has been a popular topic among folks since we have President Biden got elected, and the Democrats are really, they would like to embrace that idea of Medicare for all. It is a public option, folks. It is a public option. You know, most people in this country who are under 65, they don't know really what is Medicare is all about. You know, they have heard of their parents being on Medicare, relative or uncle on Medicare. They seem to like it because they take care of all the healthcare needs. It's a big deal. It's really a big deal. So let's talk about Medicare. Let's talk about Medicare, what it is and what it is not. What could it be? Let's start. What could it be? Let's start with the process. What is this process, Medicare? Before we go into the detail, let's look back at the history. Medicare, the roots of Medicare, how did it all start? I'm sure it looks rather strange for us who have been in the working population and getting insurance from our employer, and buying individual insurance from from health insurance companies. The way it started is the University Hospital. Baylor University Hospital in 1929. In 1929, they were taking care of the people in Houston. So when it started, the Baylor University, Dallas, Texas, basically they were losing revenue because people could not pay. They could not afford it. They could not afford to pay the hospital cost. And their revenues dwindled. And they had to come up with an idea. They had to come up with an idea how to make this viable option for this hospital. So what in 1929 and 1930, what the Baylor University, what they did is they started charging a nominal fee for people who want to get a coverage. So they will be all taken care of. So as the funds started dwindling, they wanted to see how they can raise the revenue, and they started their revenue dropped from almost like 70 to 60%. So people were not able to pay, and as a result, they had to come up with an alternative idea. So when the hospital revenue went down, this is in 1929, folks, just prior to the Depression, they tried to figure out what to do and how do we collect from a poor population. And fewer people were coming to the hospital because they could not pay. So hospital had to have a steady stream of revenue. Uh, they used to have a steady stream of revenue till prior to the Depression. Their revenues dwindled so much. So what it did it, they came up with an idea. That's how in 1929 a Blue Cross plan were established. providing the prepaid hospital care based on prototype developed by a guy named Justin Ford Kimball from Texas, Dallas, Texas. He developed a prototype and the blue plans, which are really hospital insurance plans. Started to develop out a model. What will be the cost to have an insurance plan in those days? So he came up with a monthly rate. This is in 1929, folks. If you really look at, he came up with an idea of 50 cents per each member per month to buy a hospital insurance. If you adjust the amount for inflation today, it's still worth only $7 per month, folks. It's only $7, $7. Even if you go by the inflation. 1,000% increase, yet pale in comparison to today's costs. Even though there's a 1,000% increase, it is pale when you compare it with today's costs. As you could see, the hospital, getting into the hospital could be very expensive in the present day. So the Baylor plan was an immediate success in 1929. As soon as they started the plan, these employees were enrolling into the Baylor plan. And teachers also started enrolling into the program for the insurance coverage, monthly payments for insurance coverage. Later on, the same plan came to known as a Blue Cross model, which spread to the other hospitals close by, 2-3 hospitals. But in 1932, folks, 1932, Sacramento, California, came with a similar plan. But unlike the Baylor plan, which covered for the services at a single hospital, Sacramento, California plan covered the services at any hospital in the community. This is 1932. So 26 hospitals participated in that operation. So you could buy the prepaid health plan for hospital stays. You can go to any one of those 26 hospitals. This is 1932. This contract, which lasted for almost 10 years, enrollment grew from just under 1,300 covered lives to 3 million. 3 million, folks. This is immediately after the Depression. So the major downfall of this Baylor plan was it only covered the hospital services. This is original plan. It only covered the hospital. So what happens next? Blue Shield comes into place. The Blue Shield comes into play with a similar plan, prepaid plan, to cover physician costs, physician bills, physician costs. So the Blue Shield concept, very similar from Blue Cross, grew in lumber and mining camps at North Pacific. A monthly fee was being charged, and these contracts led to a creation called Medical Service Bureau. Medical Service Bureau that so the Medical Service Bureau composed of group of physicians participating in that plan. So physicians component was covered under the Blue Shield. So in Tacoma, Washington, physicians enrollment started to grow, and also the membership grew, similar to like Baylor. So in 1930s, group of California employers, lumber and mining industry joined together to provide a physician service plan like Blue Shield. So that became a combination of hospital coverage and a physician coverage. Both the companies, Blue Cross and Blue Shield, ultimately merged, became Blue Cross and Blue Shield. That's how this is all started during the Depression, just prior to the Depression. The Blue Cross and Blue Shield, as we know of today, was formed in 1930s. Again, they were charging fixed amounts, and the providers' numbers kept increasing, and these real insurance companies came into existence, Blue Cross and Blue Shield. So the broader employer-based coverage we started during the Depression years in 1930s. National Labor Relations Act was catalyst for the employer. Basically, they didn't have much say based on, so they were eager to participate. So the success of Baylor, the Blue Cross Blue Shield plans were effective, and Blue Shield was being the first medical service plan was analogous to hospital plan, which also succeeded, and it got well established. So Blue Cross and Blue Shield was established in 1939, when they got merged. These plans had two key features, folks. What are they? Free to choose the doctors, free to choose a physician, and number two, indemnity resident service benefit plans through their doctors, a pool of doctors. They collected the money and the premiums, and they were able to get physicians and hospital services under the prepaid plan. So the Blue Cross Blue Shield companies were empowered during those years. And for the first time in 1930s, actually this is in 1950s, even the HMO started in 1950s. They ultimately, the Kaiser plans, Kaiser got introduced in 1950s, and later on Kaiser Permanente, they started building their own hospitals. So that's how the Kaiser was able to get into the managed care in 1950s. So Medicare, as we understand, is a single government option that provides basically was collecting the premiums and providing these hospital and physician coverages. as we continue to, the enrollment continued to grow into this Blue Cross and Blue Shield, the way the Medicare came into existence is it's easy to understand. What I see after the World War III, spread of health insurance coverage continued to grow, and it spread to almost 10% of the population having some sort of coverage, and which grew to, by 1960s 70s, it grew to 70%. So the Blue Cross and Blue Shield, so-called Blue Cross and Blue Shield, and the way the Medicare, I would say, in 1960s, as you all know, President Lyndon Johnson, he started this Great Society programs, 1964 and 65. What that meant was folks who are retired, they wanted to have an assurance of health insurance after they retired, after they got off their job. So many people were getting the coverage through their employer till then. But what happens when they retire? When they retire, this is how the President Lyndon Johnson came up with an idea of having some type of a coverage after people retire. So the Great Society program was to help people at the low end of economic cycle, including the not only the retirees. So they formed a Medicare for people who are retired. They can get health insurance coverages after they quit the job. And also they had a program called Medicaid for people at the lower economic end of the cycle. Though that was so, Medicare and Medicaid was enacted in 1964 and 65. This is during the Civil Rights Act. They passed this Medicare and Medicaid, and government wanted to know who would manage it those days, 1964. Those days in 1964, 65, there were no other insurance companies who had the experience other than Blue Cross and Blue Shield. What government selected was obviously had no other choice to select Blue Cross and Blue Shield companies to team up with and successfully administer Medicare program, Medicare program. Now we can see all work together after the early development of Blue Cross and Blue Shield and the expansion of employer coverage. So slowly the government started getting involved for the coverage of the elderly and for the coverage of the poor. And these Blue Cross and Blue Shield were well positioned in processing claims from these folks. And government selected them to administer the new Medicare program. This is in 1965. 1965. Roughly in 1964, there were 19 million individuals. They enrolled into Medicare legislation. As soon as they were passed, There were 19 million senior folks got enrolled. Whole spectrum of things fell in line for people who were 65 and beyond. So obviously they choose Blue Cross and Blue Shield as their administrators for their health insurance coverages. So government did not know how to manage these service these plans, but the Blue Cross and Blue Shield they were able to because they had the experience for a period of time. It's almost uh, I would say 20, 25 years of experience. So the Medicare started to evolve since then. Medicare, so the Blue Cross and Blue Shield put together a program for Medicare. This is in 1964 and 65. So they started a Part A and Part B. That's how Part A is for the hospital and Part B is for the physician component. That's how it started, Part A and Part B. So Part A was managed by the Blue Cross and Part B was managed by the Blue Shield. So what type of insurance coverage they had in 1964, you may ask. So in 1964, they started this health insurance coverage for the hospital and physician. It was a basic insurance, folks. It was a basic insurance. What is this basic meant? It meant it covered so many days covered in a hospital stay, number of days in a hospital stay, number of surgeries in a hospital, and a dollar amount attached to the surgery. That's how the basic coverage started. Whether it was a broken arm, whether it was a brain surgery, whether it was heart related, it didn't matter. So they put a dollar amount to these different procedures. Whatever the surgery was, there was a scheduled list of those items covered with certain amount of money. So the maximum amount the insurance company paid for the individual diagnosis, most important for the hospital side, they were going to cover for 30 or 60 days coverage. 30 or 60 days coverage. That coverage from 1960s to 1970s, that's the way it was, the basic coverage. But 1970s, there were other insurance companies started to develop as a competition for Blue Cross and Blue Shield. 1970, because of the technology, because of the healthcare evolution. So the other insurance companies started to emerge to compete with Blue Cross. So what happened in 1970s, folks? 1970s. The technology took over and the cost started to go up rapidly after 1970s. This is what it is. While companies sold the same kind of basic limited coverage, Blue Cross had most employers went beyond and with the recognition of higher costs that technology was bringing to the healthcare. So the Blue Cross introduced so-called a supplemental major medical because of the technology. They were introduced a term supplemental major medical. So in addition to the basic coverage, they would cover the supplemental major medical with an additional premium on top of the basic premium. The supplemental major medical covered from a certain amount, from 250,000 to 1 million. That's how sub the supplemental insurance, so-called uh, additional insurance coverage for the folks who are really sick. So they wanted to increase the coverage from 250,000 to $1 million. So they added a extra premium to the original coverage. See how everything evolved one after the other, from the basic to the supplemental. This is where the problems are. Anytime you pass a legislation in Congress, any legislation in the Congress, it crowds out to the future. What happens? So the Medicare, which was passed, was locked in 1964 and 65, was locked in with a basic plan. And they could not provide any extra coverage for the supplemental. In 1970s, they could not. See, this is slowly things tend to evolve, but the legislation which was passed in 64 and 70, 64 and 7, between 65 and 70 and beyond, the basic original legislation passed to introduce Medicare has not been reformed since then, folks. Believe it or not, it even to this day we are hung up on the basic coverage which was passed in 1964 and 65 by Lyndon Johnson. It has not been changed. So do you think the Blue Cross and Blue Shield offers the same kind of design to their employees today? Obviously, the answer is no. So the marketplace expanded the coverage same way every other employer, especially the larger employer groups, came up with supplemental major medical coverage for their own employees. This is only for the employees which they were working, not for the senior. These are only for people who are employed. They were able to provide extra because large employees have their own plans, and they're self-insured. So they started to cover major medical. But the Medicare could not do that. So that's how this Medicare Advantage started to evolve. How did the Medicare Advantage start? Because what the Medicare was providing the service, the funds they had, they could not provide a comprehensive coverage. So what they did is Medicare started to hire a private companies. This is in 1980s and 1990s, especially 1990s. They started to subcontract to the private insurance companies like Aetna and Blue Cross, Blue Shield. Blue Cross and Blue Shield, they split, they evolved, and they became statewide. They were competing each other, Blue Cross and Blue Shield. They got split, and some of them became for-profit organization, and some of them were competing with themselves from each state. So each state had a Blue Cross and Blue Shield, Aetna, United Healthcare, all started to compete to provide a supplemental. So what they did is Medicare subcontracted these private insurance companies, and they came up with a comprehensive coverage. So they were charging extra premiums. So that comprehensive coverage, when they started subcontract with the private insurance companies, That's how the Part C was formed. So Part C, you could see now, were Medicare Advantage plans. So you really let's look into it, Medicare Advantage a little later on. As I see it, the Medicare Advantage is not really a Medicare. It is replacement of Medicare through private insurance companies. A lot of people don't understand that. Medicare Advantage is not Medicare. I would like to make it clear. It is given a subcontract to the private insurance carriers. So you no longer have Medicare. You have given up on Medicare. You're being taken care by a private insurance companies, folks. So that is the Medicare Advantage. So original Medicare, which was formed in 1965, is still stuck to the basic plan, folks. And as a result, this is what it is. As it was said earlier, any legislation which passed today, it crowds out to the future because it doesn't evolve into a new plan. It still hung up on this 1964-65. Medicare is still under the same plan. It has not been reformed ever since 1964-65 when it was formed. So we need to look into that, what the Medicare can be evolved to give a coverage, so-called comprehensive coverage. There are ways to do that, folks. There's ways to provide that. So what happened? The Part A and B, then it got evolved to Part C, where Part C was a Medicare Advantage being operated by the private insurance carriers, so-called managed care organizations under Aetna, Blue Cross, Blue Shield, United. They all became managed care organizations. And that's how they were able to, in 2003, just prior to the legislation for Part D, what happened is in 2003, so in year 2000, there are many insurance companies started to compete with each other. And Blue Cross across the state boundaries competing against each other. There's more competition among the Blue Cross and other insurance agencies. And with all said and done, there was no coverage for the prescription drugs. They had the coverage for the hospitals, they had the coverage for the physician payments, but Americans were paying from their pocket for the prescription drugs. This is what happened. So Part A, Medicare Part A, funds come from a hospital insurance trust fund. That is, it is set up by the Blue Cross originally. Hospital insurance trust fund. It is financed primarily through payroll tax, which is 2.9% of the earnings, folks. So employer pays 1.45% and employee pays 1.45. He matches 1.45. So the 2.9% of the earnings were set aside into the health insurance trust fund. In 1930s, these taxes, so-called 2.9% of the tax, which about was roughly they were 88% of $200 billion hospital trust fund. Hospital trust fund. In 2013, what happened is Medicare payroll tax increased because the funds were dwindling. So in 2013, they added a 0.9% points to the high income taxpayers, folks, high income taxpayers who they were under over 200,000 and 250,000 for married couples. They added 0.9%. So they collected additional $55 billion. So they were roughly around hospital trust fund grew by 255 billion. Even though they collected the taxes from the wealthy population, but their benefits remained the same like everybody else. So hospital trust fund remained the same for all the four, irrespective of their income. What happened to Part B? Part B is called supplemental medical insurance. It's called supplemental medical insurance. It's a trust fund, folks. It is financed through a combination of different things. Financed mainly through taxes. They are talking about this payroll tax as Part B. It's really a combination of general revenue premiums paid by the beneficiaries under Part B and other sources of revenue from federal and state taxes contributed to Part B. So Medicare premiums would automatically cover, especially the Part B part, it covered the physician component. And the funds, Medicare, so-called supplemental medical insurance funds came from the premiums, folks. It all came from the premiums. And Part B funds were roughly around $70 billion from the general revenue and 14% from the premiums. This so-called Part B funds originated from general revenue, 3% from the general revenue, 14% from the premiums, and 13% from the state premiums. They were about $70 billion. So what is this Medicare Modernization Act of 2003? You may ask. What is this Medicare Modernization? Even though the Medicare, which was originally formed in 64, the basic insurance concept remained the same. What is this Medicare Modernization Act of 2003? It's interesting, folks. The way it worked out, the Medicare Part B, Medicare Part D for the drug prices. So they wanted to have a Part D for drugs to cover the drug costs that needs to be ratified and passed through the Congress. So the way it worked out, there was no support for Part D. Ultimately, what happened in 2003 under the George Bush administration, there were two things they were talking about is health savings legislation was attached to the Part D. As a compromise, Republicans went ahead and approved it, and they passed this Medicare Modernization Act of 2003, included Part D along with the health savings accounts. This is not for Medicare, for people who are working. So they can put money aside into health savings accounts. So if you're on Medicare, you cannot contribute to health savings account, folks. Even though the health savings account was passed, the prescription drugs, which is Part D, got implemented, and they had to have an additional payment for the Part D. So what happened is Part A, B, and Part C, so Medicare Advantage folks, so-called private insurance companies started to add more benefits to the coverage. So-called managed care organizations started to cover the Part D, and they were also covering the vision and dental. That's how they became popular, because a lot of folks started to join Medicare Advantage by giving up on Medicare. So private insurance companies were managing these senior folks under the managed care plan, so-called health maintenance organization. So if you really look at the final segment, the history of Medicare, even to this day, Medicare has a basic coverage. But what happened is there is additional segments added, like part originally was Part A and B, and Part C got added on because of the managed care, and Part D was added on to cover the drug prices. So the legislations were attached to original Medicare of 1964 and 65. So what is going on with Medicare? As a matter of fact, when you talk about a basic coverage under the Medicare, what happens is Medicare would, if somebody who's on Medicare, they have an added cost because they only have a basic coverage. So in today's numbers, if you get admitted to the hospital, your copay is $1,400. $1,400. After 60 days, after 60 days, you have to pay additional $352 after 60 days. 60 to 90 days, you have to $350 per day. So you have to make an additional payment. You're responsible for that payment. And after 90 days, $704. So basically, what happened is after 90 days, you end up costing you $700 per day. And as a result, most of the folks could not afford the 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 payment, so they all joined Medicare Advantage, so-called Part C, and people who couldn't afford it, they bought a supplemental coverage, like supplemental. There is an additional cost you have to pay every month. I'm coming. So Part Medicare supplemental got, and people would buy Medicare supplemental through, again, AARP would recommend United Healthcare. So most of the folks felt comfortable. They were forced to join Medicare Advantage because of the extra cost involved in this. As you could see, original Medicare is still the same. It has not been changed, and we still are covered under the basic coverage. So that needs to be reformed, folks. That's what I've been telling you about. Original Medicare of 64 and 65, they need to embrace personal care accounts and even a senior folks should have the opportunity to buy insurance on their own and set up personal health savings accounts. That's what help the seniors. So this is where we need to work towards a personalized healthcare. So we can talk about it in another segment. And this is an interesting scenario how this Medicare evolved, and it continues to evolve, but it has not been changed from the original basic coverage. Thank you for listening, and we'll continue to discuss on this Medicare for all in the next segment. I love you guys. Thank you for joining. We'll see you in the next segment. Goodbye.